Muy buenas tardes, everybody. Bienvenidos. Welcome. I hope you got into the Latino spirit. My name is Maria Restrepo Toro, and I'm a Latino from Colombia. I am the co-director of the New England Mental Health TTC, and it is our honor to welcome you to Fostering a Culture of Mental Health Recovery with Hispanic and with Latina communities and multi-systems approach communities. I am joined by a delightful team today with the National Hispanic Mental Health TTC, Oscar Andariz, the Director Ann Murphy of Region 2 and Kathy Rivera, Graciela Rees, my colleague, and Christine Isari, who lives in Massachusetts. A few reminders, you will be muted throughout the conversation, so all communication should be actually via the chat box. Our team will be monitoring all the chat. Will be recorded. All the session will be recorded, and all the mental health TTC network where you register will have it and distribute it throughout the network. If you have any questions about the current at the moment, please email us here. A disclaimer, as you know, the three mental health TTCs are funded by SAMHSA. The National Latino, the Northeastern Caribbean, and the New England. At the time of this presentation, Dr. Mira Reffi is the Assistant Secretary, and all the opinions expressed here are the ones of the presenters. Very important to know that we as a network, and in Spanish, the Red de los Centros de Transferencia de Tecnología sobre Salud Mental. It's a long word in Spanish, as you know. We use recovery-oriented language that's based on strengths and hope and inclusion about the diverse cultures that we all have, that we all bring. It is really centered on the strengths on the person, really avoiding any labeling. So we invite all of you to actually do that as well. And especially today when we're celebrating Hispanic Heritage Month. As you see this, if you are new to the network, the Mental Health TTC Transfer Center is a national network funded by SAMHSA, and we are located around the three regions. In addition, there are two national centers, the National American Indian and Alaska Native Mental Health TTC, and also clearly the one represented today in Puerto Rico, the National and Hispanic Latino. And we know the needs from Latino communities are now around the country, so that's what we're here today. So what are we doing? And as you noticed today, we're not only talking about Spanish-speaking Latinos, but also Portuguese-speaking Latinos. So we're going to be covering a lot of things today. I hope the salsa song kind of invite you to get on the mood today, to be present with us, ask all the questions. The first is we are going to tell you how we all got here together by the Director of Region 2, Ann Murphy. Then, of course, we're going to hear the most important is the Latinx Live experience from a Leslie graduate, Christine Isari. Then we're going to talk, as you see on the description, this presentation has three parts. The first one is to understand the structural challenges that Latinos communities face in terms of recovery. We're going to talk about some strategic competence that practitioners, community members, people with lived experience could use. And then we're going to show you amazing resources that can help and facilitate, created by this theme, to facilitate the culture. So now, Anne, I'm just going to turn it over to you as you perhaps can tell us how we got here today. And I'm just going to stop sharing for a moment so we can see you.
So Maria, I don't think you were sharing the slides there, or at least I couldn't see them. So just when
Oh, really?
When you switch back, yeah.
Oh, Okay.
But thank you, everyone. There you go. Now we can see them. Yep. And that's fine. Perfect.
So this is what I cover. I'm sorry.
That's okay.
There
So
we go.
thanks, everybody. I'm so pleased to be with everyone here today. Thanks for joining. And to be with my colleagues from the National Hispanic and Latino MHTTC and the New England MHTTC. We've actually been working together, collaborating for about the past 3 years with a shared goal of promoting recovery within the Hispanic and Latino community. Many of us have been working for many, many years, much of our careers, to share the message that recovery from serious mental illnesses and mental health conditions is possible, that it's real, that people experience and recovery and live full and meaningful lives. We've conducted research, we've provided education, we've provided trainings on skill development, and highlighted the voices of people with lived experiences. And more people than ever before now recognize the reality of recovery. But we still have a long way to go, generally speaking, and also within the Hispanic and Latino community specifically. And that's part of the reason, or really the main reason, that this collaborative was formed, so that we can make sure that this message of recovery permeates the Hispanic Latino community. Interestingly, the culture, the cultures, I should say, within the diverse Hispanic Latino community is embedded with elements that align very nicely with the principles and values of recovery. But sometimes the message just hasn't necessarily gotten all the way out. So to this end, our collaboration has worked to understand and listen to the voices of people connected with this work. So we've held listening sessions with behavioral health providers who work with individuals with mental health conditions who identify as Hispanic and Latino. We've talked to family members who have a family member who has a mental health condition. And we've talked to people who are Hispanic and Latino who live with mental health conditions, and heard from them some of the ways in which their culture lifts them up and supports them, some of the ways in which the behavioral health system has supported them, and also ways in which that there are very real barriers to accessing recovery-oriented care. And we have developed some events and products like the discussion we're having today. We've provided some previous webinars and trainings. We've had a learning community, a community of practice on recovery-oriented mental health services and supports for Hispanic and Latinx people. And we've developed a set of inspirational cultural cards on mental health and recovery that you're going to hear more about later today. So we are continuing this year with more activities to try to advance this overall goal. And we hope that you enjoy the discussion that we have today. Thanks so much for being here. Maria?
Thank you so much, Anne, for that wonderful. Indeed, it's been an amazing collaboration. So I think it's now my honor to introduce our guest, central guest speaker today, Christine Ivisari, which I totally mispronounced before. Christine and I know each other for a while. She is a proud graduate of the Yale Leslie Academy, is one of the leaders with lived experience within the region, and her passion has been to work with Latino communities. So as everything we do, this is central for all the work. So Christine, the floor is yours.
Thank you so much, Maria. Thank you for inviting me today. One statement that I want to share before I go on in my presentation is that everything that I'm going to be talking about today is based on my own lived experience and my own vision of that. Just keep that in mind. I know that we have a really big, broad group here joining us today, so I'm really excited to share things that I found and things that my lived experience has helped me within my role. So thank you. Maria, can you go to the next slide? So why is it important to share lived experience? So self-disclosure is a powerful tool for overcoming shame and empowering people. So we know that that is a very essential tool to engage people, to share vulnerability with people. However, I found that as a Hispanic woman or Latina woman, sharing experiences or sharing or disclosing experiences comes with a lot of other layers. Meaning that when you share something, you're sharing your experience, potentially your background, your culture, and many different things that for Hispanic people might be triggering, right? Because society has oppressed our communities in many different ways. However, I encourage you in your practice, whatever you do for work, sharing lived experience is so powerful to engage other people who have who are going through mental health, substance use, and many different things in recovery. So part of my story, Maria, if you can go to the next one. So part of my story is that, I'm also reading here, sorry. So part of my story is that I come from a family, I'm Puerto Rican youth who grew up in Puerto Rico, moved many different times. You know, my socioeconomic I was in a very poor environment, both living in Puerto Rico and then when I moved to the US. My father struggles, and to this point, he struggles with substance use. And my mom struggles with mental health, has been in treatment since she was in the age of 5. So there was a lot of things going on in my family that affected me growing up. And now I see it, and now I see all the traumatic experiences that I went through with a parent who struggled with substance use and a mother who had severe mental health issues that helped me overcome so many different barriers. As many of you have struggled, I imagine it had different struggles in your life, right? I then you know, after growing up, I had very dark thoughts of, you know, not being in this world anymore, and very drowning thoughts that were not definitely something that I want to have again. I started working in the agency that I work as right now in 2013, and I started supporting young adults, sharing my lived experience. I went to different trainings on how to do that. And that was part of my healing. That's when my recovery started. And now I am definitely an advocate for sharing that lived experience, obviously with hope and intent for others, and helping you in that recovery, right? I learned from other people, and I overcame so many obstacles in my way. So I you know, that's why I'm here today, encourage you all that lived experience is something, and sharing some of that lived experience is something very powerful. Next slide, Maria. When I thought about this lived experience situation, I work for an agency that we promote Hispanic and Latino, we support the Hispanic and Latino community. And I did some research within my own community, and I sent out a survey for those who are Hispanic and Latinos within my agency. I had a very short period of time, and I only had like maybe 10 to 15 responses. But I wanted to know, how did their culture affect them sharing their lived experience? And if you go to the next slide, Maria. So out of the 10 responses or 15 responses that I had, people said that they felt comfortable sharing lived experience. However, 7 out of 10 felt like they're sharing that felt like they had expressed barriers when sharing that information. That when I read that, I completely understood where they were coming from. Because again, there's so many barriers when you share that lived experience that can be challenging for the person sharing and challenging for others receiving, or they might look at you different, or people's own bias might come into place. So I definitely understood what they were coming, and I wanted to encourage them to share a little bit more about what made them feel uncomfortable. And I'm not sharing that information in this PowerPoint, but we had a very unique conversation about those findings. And that's something I also encourage you guys to maybe do and facilitate. Figure out, what are those barriers that people are encountering when they do share their lived experience, especially in recovery, mental health, substance use, or any other place where they're in recovery. Next slide. And like I've said, I think I've mentioned some of this. Sharing lived experience comes with a lot of responsibility. There's advantages, disadvantages that you encounter when you share these things. Advantages are ability to connect, empower, and they're life-changing. And then some disadvantages is not oversharing, right? Learning what you can share and what you can't. Disadvantages might be discrimination. People might definitely discriminate you for what you're sharing. And then fear of judgment might be a barrier of you sharing information that potentially might save or might support somebody else's recovery. Outcomes, most have been able to overcome fear. So if you constantly share your lived experience, like I do, I work with young adults and constantly sharing some of the experiences that I have, you overcome that fear of judgment because it's my story. The story that I share is real to me. And I do this to support others and encourage hope, not to diminish or extinguish their story, because everyone's story is very powerful and very important. Next slide, Maria. Okay. As a person with lived experience in the Hispanic population, I feel like we've had to work extra hard to find opportunities, which means, I think that finding people like I have, Maria has been an amazing support in my life. So finding those people that help promote growth, that help you engage with others, that you can build trust and be vulnerable with is, I think, the first step to potentially sharing some of that lived experience in your recovery. And then another activity that I had here that I wanted to share, and it kind of messed up in that PowerPoint, but that's okay. It's identifying how we know each other and our biases behind sharing lived experience. When you think about your identity, such as race, ethnicity, sometimes when you share that lived experience, you're thinking that people are already creating biases or stereotyping you based on those things. And we have had thoughts like, I'm a Puerto Rican woman, and sometimes in Massachusetts, the stigma around that I can feel like is exaggerated, right? All Puerto Ricans are, or all Hispanic women are. So just think about these things when you're thinking about sharing your experiences, your recovery. How do you identify yourself, your race, ethnicity, your experiences, your recovery? Do others identify you that way as well? Think about these things. And have you missed an opportunity because of those things that you believe identify you? Once you get to kind of realize and understand that about yourself, that fear of sharing, I think, will diminish, and it would definitely be something that you will be able to overcome. And then as a reflection, next slide, Maria. As a reflection, what you most want for yourself and your children is for you to be happy. So think about how you do this. Look into those experiences. For example, I know that if I sit down and think about all the experiences that I had growing up, my dad, my mom, I definitely can fall into a very dark place. But I choose to think about that and say, how did those experiences promote me in my life? Right? How do those experiences help me help others? So I think that's very powerful. And I want to encourage you to think about these things that I just mentioned, and use those negative experiences potentially in a positive way to help other people. And that's all I have for today. And I thank everyone for this opportunity.
Thank Christina, gracias. And I feel the same way. The way having encountered each other is not only your inspiration, but it's been both ways. So I definitely have learned a lot of joining, and that's what recovery is all about. It's caminando juntos and going together. So now we're going to move to our next presenters. As I said, this presentation has 3 parts, and we're here to share resources with all of you. And as we know, there's amazing challenges in the systems sometimes. So I'm going to welcome my colleagues, Oscar Rojas Perez and Daris Orovict, to do the following, the next presentation. Thank you. Bienvenidos.
Gracias, Maria, and gracias, Christine, for your presentation. I'm so happy you began sharing your experience with us, and some of the things that you touched upon are really important in terms of the recovery model and recovery-oriented systems. You mentioned sharing your story with hope and intent. And one of the main guiding principle of recovery has to do with hope. So I appreciate you sharing that aspect. Also, also the community aspect, as you share your experience with others, how that will empower and uplift others in your community. So what Oscar and I will be presenting today, I will begin sharing some information regarding recovery, some of how this concept has evolved in the past 30 years. I will mention the dimensions and the guiding principles and how they relate to Latino cultures, and then Oscar will speak a little more deeply in terms of challenges at the structural level. So the concept of recovery has been around for the past around 30 years, and it has been pushed to the forefront of behavioral health policy and practices, especially by advocates who have done the work, and rather than research or professionals in that aspect. And it was mainly associated with substance use disorders when this concept began to be more known. So originally, recovery was thought as the right of people with behavioral health conditions to live, work, learn, and participate fully in the community. So we see how the concept moves from being associated mostly with substance use to behavioral health as a way to integrate individuals' experiences, and we are not fragmented. So that means that as we receive services, they should be integrated, and this is really in alignment with Latino experience. So we see some of the things that are important in terms of this definition. The right of people is one aspect that I want to highlight. Participate fully in the community. So again, the aspect of community is really important in the recovery process. Then in 2004, the National Consensus Statement of Mental Health Recovery defined mental health as a journey of healing and transformation enabling a person with a mental health problem to live a meaningful life in a community of his or her choice while striving to achieve his or her full potential. So again, we see how important the element of community, meaningful life, and full potential in this definition. These are elements that are always going to be present in terms of recovery processes. And when we speak about the right, that means that our society and structures and systems need to put in place all the resources that are available for a person to have access to services and be able to recover in a meaningful way, right? So recovery processes cannot be hindered by lack of resources in a community. So moving forward to 2010, I think that's the next slide. Recovery was defined by SAMHSA as a process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. So again, we see the importance of potential self-actualization. And here we see how the language changes a little bit and it speaks about health and wellness rather than disease or difficulties. Self-directed life has to do with person-centeredness, and we'll see a little bit more about that. So as I mentioned, and I think that's included in the next slide, there are four dimensions that support recovery, 4 things that need to be in place in order for a person to fully recover. So the first one is health, and that has to do with the ability of a person to manage his or her symptoms. Home, sometimes we receive participants in our agencies and in our clinics who are struggling with different mental health issues or behavioral health issues. And one of the stressors is that they don't have a safe place to live. So we need to address safety. And when I speak about safety, I mean emotional and physical safety. So having a safe place to live is essential for every human being. And then another guiding principle that supports recovery has to do with purpose. And I'm so happy that Christine mentioned how sharing her experience when she does that, she does it with intent. And the purpose of that is to empower other human beings. And then, as we have been mentioning, community relationships and social networks need to be present to support a recovery process. Again, in 2010, SAMHSA came out with a definition that now has to do with systems, which is what Oscar and I are speaking about. And this definition of recovery-oriented systems of care is a coordinated network of community-based services and supports that is person-centered and builds on the strengths and resilience of individuals, families, and communities to achieve improved health, wellness, and quality of life for those who are at risk for mental health or substance use problems. Again, we see the same elements that are in place. So SAMHSA included 10 dimensions that are present in its working definition of recovery, and you have them there, and I will go briefly over some of them. We mentioned hope, and hope is the belief in the process and reality of recovery. And that is vital for a recovery process to take place. In terms of Latinos, hope usually is associated with spirituality. So if we think about Latino values, we see how it may be incorporated into this guiding principle. Recovery is person-driven. That means that that is consistent with a person-centered approach. And we mentioned before that when we are in a therapeutic process, we have an individual who is an expert of his or her own experience, and we validate that. So the person-centered approach, in a way, attends to the power imbalance that exists in the therapeutic diet. So we want to be able to address that because we recognize that Latino communities and other communities of colors have had experiences that where their power has been taken away from them. So we want to be able to create a more balanced relationship. We know that recovery happens via many, many pathways. And this definition recognizes that in terms of Latinos, that means that one possibility is to incorporate and recovery management models to this include traditional healing practices, which are consistent with recovery for many Latino individuals. We previously mentioned that services are integrated, so recovery is holistic, and that means that it attends to the whole being, including physical, psychological, social, and spiritual aspects of the individual. So again, this is very consistent with Latino values, recognizing the whole individual. And another thing is that for some Latinos, the expression of mental health challenges or grief or distress sometimes is expressed through physical symptoms. So we want to be able to recognize that and address the whole being in a way that is consistent with our experiences with mental health. Some of the guiding principles we mentioned already have to do with peers, relationships, social networks, communities, and all of this is recognizing the importance of the connection with others. And we think about Latino communities, we know that the collectivistic point of view is one that has to do with I am because we are. So addressing the issue of one individual will also address the issues of the community. The other thing is that recovery addresses trauma, and I will mention something about trauma a little bit later on. And we recognize that Latino communities have experienced historical trauma, intergenerational trauma. So again, this guiding principle is consistent with our values. And recovery is based on respect. And for Latino communities, the value of respeto is very important. So I want to make another note. Previous models really haven't, that are based on biological, biomedical models, haven't really served disempowered persons. So this model seems more consistent with the experiences of disempowered communities and communities of color, and have given place to the development of models that are more in tune with the experiences of some of our minoritized groups, including indigenous individuals, and African Americans, Black communities. For example, the Afrocentric framework of recovery is one of these models. Recovery management also recognizes that the etiology of the development of different symptoms occurs in various ways. So this means that we recognize and we know what we know as risk factors will differ between and within communities. So we need to consider historical, economic, political, and sociocultural circumstances that can be a part of what later on results to be a behavioral health difficulty. And speaking about these issues and exploring the things that come out from these experiences opens pathways for communities to heal and to transform. Recovery recognizes culture, which is very important as well, and which is part of why we're speaking about all of this. And culturally grounded models of recovery reflect an understanding of the effects of intergenerational trauma, which we mentioned that previously when we said that recovery addresses trauma, and it may be experienced as grief, rage, self-harm, and self-medication. Again, I want to mention, I mentioned it briefly, that in Latino communities, the individual, the family, and the community are one. So if one is wounded, all are wounded. That also means that if one is healed, we are healed. And another point that has to do with trust. which is one of the guiding principles, I want to mention that the historical victimization of people of color has left a legacy of mistrust and caution when approaching relationships. So we want to be able again to address that, and this model recognizes this because especially that happens especially when there's a high discrepancy of power in the relationship, like it may happen in a therapeutic diet. There's a relationship that's going to be brief, which is not consistent with the recovery process. So again, the importance of peers in supporting recovery. So with that said, we have some of the basis of what the recovery model encompasses, some of the elements that systems should incorporate, and Oscar will speak on that as well.
Welcome,
Is
Oscar.
this,
Yep.
can you go to the next slide? There we go. Thank you, Maria. And thank you, Daris and Christine. Thank you so much for sharing your lived experience. I've been doing, lately been doing some readings, and it's great to, and hearing your story, it really prompted me to think about how your story does bring research to life. And I think oftentimes when we get stuck in the literature, we forget that there are actual lived experiences. So thank you for that reminder and you sharing that, what we write, what scholars write, and what we conceptualize and theorize, it all comes to life when people like you are able to share your lived experience with us. So thank you so much for reminding me the importance that there are people behind the words that we write. In addition to that, I want to definitely express gratitude and for the invitation to be here. And it's great to be in community. And Daris, thank you for the great segue of allowing, with transitioning to what I'll talk about. And hopefully folks find it that it's aligned with what has been shared so far. And I'm going to go ahead and take more of a systems approach to this. So stay tuned. It's definitely going to tie into what has been discussed so far. So when we think about research and in the research realm, research has identified the various forms of challenges experienced by the Latinx community and recovery of mental health concerns. And I'm going to use the term Latinx just because I want to be inclusive of our gender nonconforming individuals and our members of our community. So I'll transition to use the term Latinx. And I do recognize that it's a term that sits in the ivory tower. So I want to acknowledge that as well. But going back to this, even though there are various systems or various ways in terms of the challenges that we experience, whether it be at the individual level, cultural, whether it be public or institutional, I'm going to really hone in on the institutional structures that have really created challenges or served as barriers to healing and the recovery process of our community. So as many of you already know, there is a dearth of data on how to effectively address mental health challenges at the structural level. However, researchers in the United States have found that in general, people with mental health concerns favor approaches that address institutional and structural discrimination over those that focus on public education when it comes to mental health healing. Keep in mind that part of the challenge in supporting mental health recovery among Latinx is the result of oppression grounded on colonialization and racism. Essentially, barriers that have been intentionally created to continue harming members of our community, and when broadly they're said that they're developed to help and heal, but they actually do the contrary. So since colonialization, the US has and continues to other individuals that do not fall within what has been considered the norm or normal functioning, which has been set by a level of individuals who hold privileged identities. So in essence, the standard has and continues to be majority white, and what colonial mentality has deemed as normal functioning. Who knows what that is, correct? Now, it is important to recognize that race and ethnicity is another barrier to care, as research shows that people with mental health concerns are marginalized and discriminated even more when their other minoritized identities are brought to light. So say being a woman, a queer woman, and a queer woman of color those identities must be incorporated into the conceptualization, because it's important to consider, right, when we're thinking about recovery, it's important to consider the intersectionality. So taking this approach from an intersectional lens, thinking about how structures have historically, right, institutions have historically oppressed individuals with various minoritized identities. And as a, going off of that, as a result, folks who have often looked at, in terms of when we look at healing processes, healing is based on historically on what has been considered or normed the standard, which oftentimes really taken from a lens of validation from the oppressor. So in this case, the oppressor is systems of care that have developed parameters and limits of what is considered the norm, which again have been developed by a group of professionals who shared privileged identities. So when we think about structural challenges in supporting the mental health recovery of Latinxs, it's important to consider the role of colonialization and racism and the impact it has on the recovery of mental health concerns among the Latinx community. Now, folks may be asking, well, how does colonial mentality and racism show up in systems of care? Which I would say, totally valid question. Well, let's take it to consideration in the moment. Let's use the example of DEI statements, diversity, equity, and inclusion statements. As we know, over the past couple of years, many mental health agencies have put out their own statements, which probably state that they value diversity, inclusion, and equity, and how important it is to work from a culturally responsive lens. Inevitably, they sound wonderful and inclusive, really setting the tone of validating the whole person and focusing on the person in the context. Now, on the other hand, there are mental health care bureaucracies and procedures that by no means embody these values. As a result, the research shows that you have racial and ethnic minoritized providers and individuals with lived experience that do not feel welcome in mental health care systems, which continues to contribute to the mental health inequities experienced in the US among Latinx communities. When providers leave, which essentially as a result of various barriers, many mental health agencies are experiencing, well, as we know, many other health agencies are experiencing that at the moment, low staff. It creates a backlog of individuals with lived experience needing services. And we already do not have enough providers of Latinx origins that are bilingual and bicultural to begin with, right? So we're continuing to engage in this perpetual cycle of not being, we talk about the importance of access. Access is a significant barrier, and at the same time, the biggest barrier is not having culturally responsive, trained clinical providers. Further, a growing body of evidence is revealing that the various forms in which systems of care further perpetuate barriers to mental health services among the Latinx community. So in recent research and recent review, burnout among mental health care workers, physicians, burnout of mental health care providers, physical health, they're noticing a lot of mental exhaustion were identified as significant issues requiring organizational and cultural change to support healthcare providers' ability to cope and be able to provide healing interventions to our community. So when we think about systems and how they continue to hinder the pathways of healing among our Latinx community, we wonder, well, what can we do at the institutional level? Well, we need to go back to the drawing board and reconstruct how we think about mental health access and service at the system level. What does that look like? For example, training programs need to do a better job at recruiting and retaining the next generation of Latinx mental health providers across the various disciplines, whether that be MD, psychology, MSWs, and so on. Second, we need to rethink the curriculum and include trainings on the lived experiences of Latinx with mental health concerns and how to provide culturally responsive services. So are we teaching from a Latinx-centric lens, or are we continuing to teach the next generation from a Eurocentric lens that continues to perpetuate the harm that has been inflicted on the Latinx community? Third, we need to invest in community clinics and bring the treatment to our communities. Fourth, we also need to invest in the recruitment and training of bilingual and bicultural Latinx peers. And from my lens and in the research world that I live in, I think peers are critical and essentially the bridge to our community. Essentially, they are folks who are the trusted sources. When we think about when we hear advice or when we hear a recommendation within the Latinx community, and the research shows, we're more likely to take advice and suggestions and recommendations from a trusted source, which are often members of our own community, than versus an institution. So peers are, in my lens, really critical to the healing pathways of our community. And finally, fifth, when we think about, and essentially just thinking about our approach, and Daris was doing a wonderful job at really talking about this and hitting the nail on the head, is when we think about the curriculums currently in place about healing pathways, they're centered on the individual. And yet, when we work from a cultural lens, we realize that the Latinx community is a collective community. So essentially, our interventions need to focus on community healing. Once the community is healed, then we can continue to move forward on our pathways towards recovery. If one individual is in that process and the rest are not, there's this sense of disconnect, feeling as potential some experiences of betrayal, I'm not there for my community, and so on. So we really need to reinvent or rethink our interventions to really focus on this community healing pathway versus this individual healing pathway. So when we think about structures, there are many things that we can do. And even within our own structures, it's important to think about, even within the own systems of care that we're a part of, it's important to really think about what is it that is limiting us from being effective providers, effective members in the workplace. What are the barriers within our own system that are, even though they've been developed to provide care, think about them, how they're intentionally, maybe potentially designed to continue to inflict harm or limit access to the Latinx community and their mental health recovery process. So I'll go ahead and leave it with that, and we can continue to move forward. So thank you for your time.
Thank you so much, Oscar. And this was an amazing overview of all the barriers and the systems, and also really a lot of hope underneath how we can attend to this. So there is a question, and perhaps while we continue with the presentation, you guys, there's a question about the term Latinx originated. Also, if there's any research on acceptance of that term versus Latino Hispanic individualists. So if any of the presenters can put that forecast us to everybody, I appreciate that. So now let's move into the next level. So as Oscar and Daris described it, and this would be really talking about, so then we know about the values, we know about the systems, about the importance of community, about the lived experience. And how can practitioners, providers, and that includes, of course, peer supporters as well, how can we then actually start helping individuals promote this? And we're going to give you some information, not only share some experiences for Spanish speaking, but also for Portuguese speaking. So my colleague, Graciela Rees from the Yale Program on Recovery and Community Health will be joining me. So how we then
Maria, I have a question.
Okay,
do you want us to answer the question now, or should we?
Oh, okay,
continue?
Perhaps. Yes, if you do, go ahead before I start.
I think we can do that. The term Latinx was originally seen at around 2004 it was more around the internet, let's say, and it was promoted mainly by the LGBTQ plus community as a term that is a non-binary term that is more inclusive in terms of, and Oscar, you can add more if you want. I just want to say that in terms of the acceptance or non-acceptance of the term, a few years ago, the Pew Research, Hispanic Research Center published a survey where they found that 3% of Latino individuals identify with that term, and it's mainly used around academians and university populations. Still, it's a term that is more inclusive and appreciated throughout the communities. So I'm not sure if Oscar wants to add anything.
You said everything that I would have said. You're right. It did derive from queer spaces on the internet to be more inclusive, right? When we think about the Spanish language, it's genderized, right? Male, female, and we often forget that there are members of our community who are gender nonconforming, and it's important to be inclusive. And you're right, the research suggests that, and I'm just reiterating everything that you said, that the research does suggest that people prefer to be identified with their country of origin. When we think about even just the term Hispanic and Latinx and Latino, they all have historical origins in colonialization. For example, the term Hispanic is often used by folks who are lighter skin, higher SES, and the term Latino tends to be used by folks who are lower SES on the darker side of the skin, on the skin tone spectrum, right? So there's even racial implications around which term, who uses it and how it's used. Currently, at the moment, as I mentioned earlier, the term Latinx mostly sits in the ivory tower in institutions of higher learning. And that's because we have a lot of younger generations, folks who are more acculturated, who want to be more inclusive, who are trying to change the landscape of how we view the Latinx culture, given that, even within the culture, there are so many differences, and we want to make sure that we're inclusive of all members of our community so no one feels left out. So again, nothing different than what you said, Dari. So thank you for starting us off.
No, I'm glad you mentioned that, and I'll be super brief. I agree with you, and in fact, the term Hispanic was developed by the U.S. government and initially used in the U.S. Census as a way to group a group of people that had something in common, mainly the language. So it wasn't a term that originated from our communities. And you're right, most persons prefer to identify by their country of origin. So yeah.
Thank you.
Thanks.
Thank you both. And yes, I concur. And if you notice the title of this is adding Latine, which is, I know at least from countries in Latin America, they're starting to use the La E. Interchangeably, that's how they've been kind of starting to use. So we'll see where that goes.
Maria, can I say just one more thing? This is just the last thing. I think it's important to think about how language is is weaponized, right? When we think about just within Latino culture, Latinx culture, we think about just the terms that we use and how they're genderized. It's oppressive to women in some way. So it's important to think about how language is weaponized and how it can be oppressive to members of our community. So that's all I'll say.
Thank you, Oscar. So now we'll just gonna kind of bring it back to the provider level, or the people that are providing services, the practitioners. And for this part of my presentation, I'm going to use my experience as a practitioner of psychiatric rehabilitation. I've been around for a long time, and I work at the Center for Psychiatric Rehabilitation at BU, and currently I am working at the Yale Program on Recovery and Community Health, but I'm kind of merging the experiences that I had in terms of bringing you some practical skills at the practitioner level to be promoting all this. So I think I just want to just kind of recap what has been discussed, especially how Christina alluded to what recovery is. So as we know, there's a big difference between recovering from and recovering in. So, when we talk about recovering from, we know that there is this spectrum of treatment, and people are, needing at certain times of their lives or in their, life needed treatment, and in order to really eradicate symptoms of the illness caused by whatever diagnosis they may or may not have. So that is sometimes the kind of the task of some of the clinicians per se that are working actively in treatment. As we heard, being in recovery really is about a full life in the community where people can actually move forward with their lives regardless of they do have a diagnosis. And we know that when it comes to mental conditions, it's always definitely more stigma. So it's important as practitioners, roles that you have. And I think what's underneath all these principles and the systems is very important that you recognize that you could also be the force that can be really bringing hope to heal that divide between the us versus them, patients versus doctors versus, you are the local one versus the wealthy one, so the healthy one. So there's all these cultural issues that really separate us. And what we're saying here in recovery with a recovery perspective is we want to see people as people. We don't want to see them as labels, as diagnoses. And it is so powerful that we actually pay attention in how we as clinicians were trained, what kind of, were you only learning from your DSM-4, the diagnosis category, and doing testing to reduce symptoms. It's so important that we get in touch with our own learnings and our own internal, as different practitioners maybe have trained. So this dividing is very important when we challenge our all assumptions as a practitioner level, as an agency that is working. Are people where people train only to really think about the historic and the brain disease issues, or are we approaching this from a holistic perspective, which is what recovery-oriented practices are about? So as you heard in all the system and all the principles, and clearly from Christine beautifully, is the most important component is for always to partner with somebody in recovery. People in recovery are the most essential element in bringing people their own lived experience. And by that, I mean, we all may have different lived experiences that may relate more to this or to that as a Latino. So we're inviting all practitioners, I'm using the term general, okay? That includes peer workers and everybody, community health, any kind of person providing according to a type of mental health service. We wanna invite everybody to really come into this relationship as a partner, okay? We wanna be able to have people in your program. So you heard about the systems, but in order for us to move that into, are your programs honoring the person's lived experience as a central point? Are we thinking about goals? And what we mean goals, we mean the dreams. Again, we know that goals go beyond taking your medication. Are people hearing messages such as, well, maybe you can go back to work if you take your medication? Or is La Abuela saying, well, maybe it's too soon for him, he's going to have a crisis if he doesn't take his medication. So what are the goals really, and how are we actually defining goals? And I think there is mentioned person-centered, strength-based person-centered approaches. This is just a kind of an overview, and we're not talking about this here today, but when we are having plans, first of all, that have to be developed by the individual receiving the services, we want to understand that goals are things that we are moving towards, are not goals to be eliminating things. Is we want to have the goal that either you or me have in our lives. It's not different because somebody may be living with a specific health condition. So it is very important that that goal, that you are centering your interactions around the goal. And again, this is just a very quick example, but you can definitely get more resources about that. It's not the intent of this. So this is a kind of a very important principle that we all think about this. And I think in terms of, as I said at my beginning, there is Latino, Latinx, Hispanic, Latine communities, also include Portuguese-speaking communities around the country. So I am going to turn it over to my colleague, Graciela Ruiz, to just give us an understanding from that perspective and for providers from that. Gracie?
Thank you, Maria. I would like to thank you, more than 115 participants in this webinar today. And I think that is a beautiful way to celebrate Latin and Hispanic Month. I am Graciela Ruiz. I am a psychologist by training. I am a very proud Latina. And I want to have a conversation with you. So how you can promote competence when we are working in a mental health field. because you have in the United States a very consistent work related to recovery. And I think to talking about recovery, you also need to understand the implication that with the history. So as you know, the movement starts in the 30s from the consumers called here in the United States. And this movement was all about social justice and human rights. For any clinician here in the United States or in Brazil or in Colombia or Argentina or Puerto Rico, understand this story and see how does impact our work, how does impact the way that we will offer and work with people in process of recovery. It is important because in some level we are talking at the same thing. It's about social justice, inclusion. It's about to fight against racism. It's about to building a sense of belong at the community. And this community, it's a complex community because they have system and structures that will push you in or out. So first of all, have this slide in Portuguese means a lot for Brazilian community because we are trying to promote recovery among them here in United States and also in Brazil. And we are talking about how together we can let people know that stigma around mental health, it's never helpful. And in this sense, I would like to start my presentation, talk about recovery in the point of view that Brazilian community has been discussed. And we say in Brazil, you say here in the United States, that recovery emerges from solidarity. And why it is important, why you need to talk about solidarity. Because when you have an immigrant that move to United States, they come from Brazil, but they can come from any country in Latin America. We have a structure in place. You have our family, you have your house, you have our job, you have access to healthcare, you are engaged in our community, we have our faith and our spirituality, you have relationships, you have people that you love, you have food that you enjoy to eat every single day, you have our house with our things, you have culture enjoyment that it's really connect with who you are. So something happened with an immigrant, then decide to move to another country. When they decide to move to United States, there is some connection, that is a break in what you have from your country home and what you find here. So, and what happened in this time is that for all these reasons related to the culture, related to who you are and the values that you represent, you bring with you in your culture, for some reason, we lost this when you moved to here. You don't recognize yourselves in your body, in your soul, in our feelings. And that is the point that I think all the clinicians need to really be curious and pay attention on that, because that's caused a lot of assumptions. We start to give people diagnoses, depression, anxiety, psychosis, bipolar disorders, intense trauma, schizophrenia. People start to get confused, substance use. And we go through that without making a very simple, important question. I'm not saying here that it's not real and people will not suffering from mental health. That's happening. What my question for all systems of care and clinicians is, what we are losing, what you're not seeing, what is the no told story that's part of our work for a clinician. or for who works in a social being. And I think recovery brings to us a question. Maria, just go to the, get back, Maria, a little bit, please, for the last one. So I think you have a very important question here that we as a clinician, you should to thinking about every single day. What is the question that mental health professionals should ask themselves? What is the question that we need to ask themselves? And these questions is related to the persons in front of us. It's related where they come from, because we talk about recovery here, we're talking about the principles, we talk about the systems. You know, you need the system, recovery-oriented system to advance mental health here in the United States. But what is the question that clinician it is working on when they go to school, when they providing or receive supervision? So what you're losing on this point, because recovery is to see the person and the point they are. Recovery is about connect with the people. Recovery it's about to get people understand the feelings. Recovery it's about understanding language and behavior and how you express your feelings and the way that you're learning from your country, from your home. So and and what should be a mental health clinic for that? So how you change that? How you become more oriented recovery care? So from some studies we did with Brazilian, we got these things. Brazilian Portuguese immigrants are welcome. They have identity. They have things to say. Access is to facilitate by service for Portuguese and culturally sensitive development. Sustain funding, develop a collaboration with the Brazilian Portuguese community, develop education programs and research to address the scarcity of Brazilian Portuguese mental health professionals. Cultural needs are addressed, psychosocial needs also need to be addressed. So talk about recovery, and I'm finishing with that. It's much more complex than study or develop research on theory. Talking, living in recovery, it's about build connection for who is in front of you. And that request that you be available to be what you believe and what you like and provide what the people need, not what you think, but what people need and ask for. That is recovery for Brazilian community. Thank you.
Gracie. Thank you, Gracie. So now I think with those recommendations, I think we're going to move into what we can do. I think, and this, as I said before, this work came out of a study I did at Boston University with all my colleagues there, and we did develop really a sample from all, as we know, there's a lot of diversity across the country and representations from different countries in order to really understand how can then one promote recovery. So we're now moving into some strategies that can actually intentionally be done, because I know there's sometimes we can think it's beautiful, the values we really adhere, but then how we transfer that into actual actions. And there is a lot of literature out there about promoting recovery competence. And of course, you can go to the website that is on the slides to do that. And in fact, there is a program that's in Spanish, all the different modules that we developed at that time to really guide practitioners in how to actually learn how to promote recovery-oriented competences. There are tools out there that can help you assess where you are, where your program is in this. So for example, this, and again, these are in Spanish, but I'm gonna just very quickly. Some of these are quite logical, but all of this was informed by people with lived experience from all different communities, from California and the border with San Diego to people in New York from all the ethnicities across. So this not were just things we make up, but we did some analysis, and the themes that we found is that it's extremely important to educate people around recovery, and this is why we have this collaborative, actually welcoming and creating spaces that are welcome, spaces like we want to be treated at. Very important for among communities to share inspiring stories like Christina's we heard today. And I think she described the whole very beautifully in her story, how she was able, when there was an opportunity for her, she was able with a new role actually move forward. So it's very important about, and we heard this from people in recovery and their families, how important it is for everybody to keep promoting recovery stories among our Latinos. That is the most powerful reducing a stigma that one can have. In terms of empowerment, so the concept doesn't stay as an empowerment. We value that. Is really, again, using tools that already exist, like the person-centered planning and many others that exist out there. Really make partners with the people that you are serving. With the people that you're working with. This is about shared decision making. It's about joining the person. You know, some of the other things people said with all the pets opportunities to assume responsibilities, and opportunities to actually implement and show the strengths. And lastly, what clinicians, practitioners could do, what we found is the importance of helping the individual that working with promote self-acceptance, because it's so important. This is when we talk about strengths, values, strengths, this is what we want to hear is practitioners concentrating and pointing out to that person, look how important it is, look at the great job. And I'm not talking about being patronizing, I'm clearly talking about being able to show the person's strengths, to respect their individuality, whether, as again, we heard, we want to be identified of the country we are from. We want to know and be shown, because sometimes when we are in a difficult space, we don't see any good on, not only on life, on ourselves. So we need a partner that's going to show us, you are doing this great because of this and this. So there are intentional skills that practitioners can learn in order to promote the recovery, to change systems of care, and to be able to provide more access to all the Latinos around recovery. And just a question, we will be, of course, promoting, you know, we always do put all the presentations and all the resources will be there. So now we move to another very concrete tool, which is the project that Kathy Rivera is going to talk about it, because those are the kinds of things that are going to be making recovery a reality. So Kathy, it's my pleasure to welcome you to talk about walking in recovery.
Thank you, Maria, and thank you to our colleagues who have also provided such wonderful insight and input in all of the layers of recovery, going from the systemic societal provider as well as the individual. Hello, everyone. My name is Kathy Rivera. I am the project coordinator of the Northeastern Caribbean MHTTC, as well as an education and training specialist. Next slide, please. So just really quickly, for those who are still with us this afternoon, in the chat box, could you just please answer yes or no? Do Hispanic and Latino cultural values interfere with the principles of recovery? There's no right or wrong answer. I just want to get your perspective. So I'm going here into the chat, and I see that many believe that yes, that it does interfere with the principles of recovery. Okay. That's very interesting. So I'm going to just give a little bit of insight into the cards that we developed among the three centers. There are these wonderful cards. If you can go to the next slide, please, Maria. And in the slide, in the cards, it addresses different, I guess, cultural values as well as ideologies that we can incorporate as discussion points in engaging someone from the Latinx or Hispanic community. For instance, the first one is in reducing stigma and discrimination. And if you encourage and empower the individual as being person first, they're not their diagnosis. If you see on the slide, it says, I'm a person, not my diagnosis. It will help reduce stigma and discrimination. One of the foundational beliefs of person first language is that individuals are more than just their diagnosis. Traditionally, our language tends to identify someone with their diagnosis or disability as being all-encompassing identity, but this is an inaccurate representation of a person's identity, and it can also be the root cause of many forms of stereotypes and stigma. For example, when referring to someone, instead of calling them or defining them by their condition, it's better to say, and it's more preferred to say a person living with depression, a person living with schizophrenia, a person living with anxiety. Their disability diagnosis or condition is only a fragment of the person's life, and it does not have to define it. This corrected use of language is necessary because language matters in shaping the perceptions, as well as it can also lead to disrespect, embarrassment, or harm to someone's self-esteem. Using person-first language addresses the stigma related to a particular mental health condition, and it also addresses labeling. People who might be labeled by their condition may also increase a sense of devaluing and exclude them as an entire group from society. These terms become social barriers that also deter individuals from full community inclusion and expression. Using person-first language also elicits empathy. For example, instead of describing someone by their condition, we can always refer to them a person, how they would like to identify themselves. Even if they don't want to disclose their diagnosis to someone, that is still their choice. Person-first language allows a person to preserve their personhood, and in and of itself, recovery also allows the opportunity for self-discovery. Next slide, please. So in this card that we designed and developed, we also highlighted the importance of community and how community and social support helps promote resilience. Having social support may increase feelings of belonging and solidarity, and in and of itself can encourage healthy coping behaviors. A social support system is often identified as a key component of having solid relationships, having solid, strong psychological health, and it also helps cultivate the feelings of belonging and connectedness, which is crucial for everyone, not only a person living with a mental health condition. Research has also demonstrated the link between social supports and many different aspects of health and wellness. Poor social support has been linked to feelings of depression, increased alcohol use, cardiovascular disease, depression, and suicide. It's also important to highlight that there's different types of social support. There's emotional support, there's instrumental support, which is someone who is seeking actual concrete materials or concrete actions such as educational material or mentorship. There's informational support, and this includes guidance, advice, information. And it's important because it also empowers that person in making choices in their recovery process. Next slide, please. And then our next card that we developed also addressed, these are also very great talking points and conversation starters when you're meeting or trying to engage with someone within the Latinx community. And it states here, my mental illness is nothing to be ashamed of. So this card addresses more the stigma. Some strategies to address the stigma include talking openly about mental health, seeing it as something of a normative conversation instead of adding to the taboo or the stigma, encouraging the education, the psychoeducation, being conscious of language, using that person-first language, encouraging equality among the provider as well as the person seeking treatment or services. There should never be like this power imbalance or I know more than you. They're the ones that know themselves the most. They're the ones who are the experts in their recovery journey. Showing compassion, being honest and open about what the treatment might look like, or what their course of treatment might look like, and also encouraging them to set their own goals. And I'll discuss this more in the next slide. Offering your advocacy, empowering the person to cultivate their own agency in the recovery journey is also crucial. Next slide, please. We also want to encourage the person in recovery to custom tailor their recovery to what their needs are. So this includes being self-directed, encouraging them to lead, control, and exercise their choice and determine their own path to recovery, optimizing their autonomy, their independence. What kinds of supports do they want? What kinds of supports do they need? They get to choose. Also encouraging a more holistic approach. This includes their, physical health, and then the next slide, I'll discuss more of the spiritual component, but encouraging them to also incorporate those elements that might be important to them, as well as their basic needs, addressing anything that has to do with housing, employment, education, healthcare, and their access. And I believe our colleagues spoke about, more of the structural and societal barriers that still need to be addressed in order for their basic needs to be met, but also having an understanding that those are just as important in the recovery process. And lastly, addressing that recovery is non-linear. It's not a step-by-step process. It's continual growth, occasional setbacks, learning lessons from the experience, and then empowering them with the knowledge that recovery begins with an initial stage of awareness and that positive change is possible. So lastly, we're going to talk a little bit about incorporating their spirituality. As providers, we need to recognize the important role that spirituality and religion can play in a person's recovery. Sometimes providers may not be well trained or maybe don't feel comfortable discussing the role of spirituality in the person's recovery process, but it's really critically important. Religion is a protective factor for mental health in the Hispanic and Latinx community, including faith and prayer, but can also contribute to the stigma in mental illness and seeking treatment. So we normally advocate for outside agencies to have linking or linkage to these religious institutions, because those are sometimes places where a person of Hispanic or Latinx descent might first seek guidance or treatment is in their faith-based provider. So with that, I will turn it back to Maria, and thank you again.
Thank you, Kathy. That was wonderful, everybody. So I think it's time for questions. There's a question. I'm going to invite all the presenters to join me back on camera. I think as you can see, we hope that you have been able to hear the journey from the systems, the more of a service provider level and practical tips. Everything, of course, has been centered around lived experience. The question actually refers how then we can start making the change in the chat. It says, how does it get implemented in a culture when it is a taboo to recognize? And that is exactly, and of course I will invite my colleagues to share, but that was the purpose behind the cards. The cards, because we did learn when we worked together that the stigma is one of the really #1 barriers to access mental health care. Where we provided participatory as it was described at the beginning, and we came up with these cards, and those are great tools for you to start the conversation with people around what recovery. So it's about changing the conversation and showing people, and just also hearing stories like Christine's and many others as well. So that is a question, so I will invite anybody else to answer that. I know I'm mindful of the time. We have 5 minutes left, so want to make sure that people, nobody else, I don't know if people have raised their hands, or I thought
I can share something. One of the elements that we've mentioned through our conversation today, that is incorporated in recovery models, is we spoke about the importance of including community members. That is definitely a way of addressing stigma. If we have peers who are members of the community, who have the trust of community members, these are important allies in conversations regarding recovery. Like you mentioned, the cards can be a way to begin a conversation. Reaching out to communities is definitely one of the elements that should be included for that, to address stigma.
And to add to that, thank you, Darius. There's some great literature out there on how to address stigma, and one of the interventions is called contact-based intervention. And it's essentially what we had Christine do with us today. Basically, this is more of a public kind of way to reduce stigma, but contact-based interventions seem to be the most effective, especially within Latinx community, where you have the concept of share, like convivir, this experience of being in community, and being able to do that, and essentially normalizing the process that having a mental health concern is, there's nothing wrong with that. And that's why I never even use illness or diagnose. I try to just say concern. It lessens the blow. It sounds more like a preocupación, just a little worry there. So it just comes down to language and normalizing it, and contact-based intervention seem to be an effective strategy for that.
Thank you, everybody. Any other questions that you guys, Kathy, you see? This is the only question I saw, but
Yes, in the Q&A pod.
yes.
Okay. How does it get implemented in a culture when it is taboo to recognize an issue as related to mental health? I guess going back to the stigma.
Peace, yes.
Another thing, and if I can add another thing that comes to my mind, and for folks, hopefully folks have access to libraries, university libraries, to be able to download some great articles, taking the cuento therapy approach. Cuento therapy derived from Puerto Rico, and it's a way of just kind of relaying the message. And I think taking that cultural approach is based on storytelling. So storytelling, again, exactly what Christine did with us today, is a great way to be able to do it.
Okay, let me see. I think there's a raised hand, but I don't seem to be able to see who that is for some reason. It's anybody. Kathy, just want to make sure we answer everybody's questions.
See a raised hand. I did send them a message, and
Oh, okay, great, thank you.
Your response.
Okay, so I think lastly, just because we're about to end, clearly all of our centers have been dedicated to actually, oops, hold on, let me see here. A lot of resources and cultural responsive resources have been developed. You can come there. The mission, our funding is to really provide free training and technical assistance. Please check the National Hispanic and Latino Mental Health DTC for a huge library of different materials, archive, webinars. As you heard, there is also information on the Northeastern Caribbean and also the New England Mental Health DTC. To our presenters, and to clearly, it's been an amazing privilege and journey to work with the other two mental health TTC and developing and joining efforts. This is something that we all need to be working together, since there's, we just need more and more people. So if anybody on the team would like just to end with any gracias comments for the group. Christine, your story was absolutely powerful. We really thank you for that, and very inspiring. Thank you, Martha says, for a great presentation. Any final goodbyes? Gracias.
Thank you, everyone.
Okay.
Everyone.
Well, we'll
Thank you.
put the recording. Thank you. Wonderful information. Okay, so I think we can stop the